Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Sara-Chana Silverstein, and she's speaking about her new book, Moodtopia. Sara-Chana is the author of the newly released book, Moodtopia, Tame Your Moods, Distress, and Find Balance Using Herbal Remedies, Aromatherapy, and more. Her book got accolades from Deepak Chopra, Dr. Avia Ram, and Mayim Bielk. She's a Master Herbalist, Classical Homeopath, Board-Certified Lactation Consultant, and mother of 7 children. She's regularly featured on CBS, ABC, NBC, and Fox News, and popular podcasts discussing how people can integrate alternative with conventional medicine. She's a consultant to many types of doctors, midwives, OBGYNs, pediatricians, and is currently guest lecturing to residents at New York medical schools. She's worked for the past 28 years educating parents on how to safely treat their children and themselves with herbs and homeopathy. She empowers her clients, giving them the tools they need to keep themselves and their families healthy and confident to make proper medical decisions by teaching parents how to understand current research and ask the proper questions of their doctors. For more information, please visit her website at moodtopiabook.com. Hi, Sara. I'm so excited to welcome you to the show today.
Thank you, Laura. This is going to be a great interview. I'm really looking forward.
Yes, definitely. So, let's start off with having you tell our listeners about your new book that just came out called Moodtopia, Tame Your Moods, Distress, and Find Balance Using Herbal Remedies, Aromatherapy, and more.
Yes. So I'm a lactation consultant, and I've helped, thank God, over 28,000 babies and women breastfeed. And I had also studied classical homeopathy and herbal medicine at the same time as breastfeeding. But people would come to me as a lactation consultant, and I would see that there was a plethora of so many different moods coming through a woman. Right after she gave birth, she'd be thrilled and she'd be sleep deprived. She'd be so happy, and then her baby would be crying. She'd be so grateful she had a healthy baby, and then she'd say, "Oh my gosh, are you sure my baby's healthy?" So women's moods and emotions were going up and down and up and down. And although I wrote the book Moodtopia for the general public, Laura, it's really based on my experience as a lactation consultant.
Yeah, and that's definitely your passion. You were sharing with me, you've helped 28,000 babies breastfeed, which is really like a mind-blowing amount of families that you have supported. And I know, I see a lot of new moms and babies in my practice. And from a chiropractor perspective, I'm working on alignment to help with the breastfeeding experience. But it is hard. It can be hard work for some dyads. And I know it was even hard for myself to breastfeed. So I see how intensely emotional it can be for women.
Well, as a lactation consultant, this is what, the statistics that I looked at recently was pretty bad about the success of breastfeeding. The report I read said that less than 20% of people continue breastfeeding past 6 weeks in the U.S., Laura. That,
Wow.
In hospitals, it's breastfeed is best and breast is best. And, it's a big hype. But the problem I see is that most women really need to learn how to breastfeed. And most babies need to learn how to breastfeed. And although women may have the desire to do it, Laura, women can have funky nipples. Babies can have high palates, low palates. They can be high tone, low tone. They can be tongue-tied. They can have trouble coordinating suck, swallow, breathe. Women can have a different nipple on their right than their left. They can have flat nipples, large nipples. Why am I even mentioning all this? Because I really believe that in the care of pregnant women, it should include breastfeeding. The doctors and midwives should assess the woman's breast and discuss breastfeeding, Laura, from the day they walk through the office. And I'll have women come in my office with completely flat or inverted nipples. And they'll sit here in my office with a 4-day-old baby sobbing because the baby's yellow, dehydrated. And they're like, "Well, why isn't it working?" And I'm like, "Did you know you had a flat nipple?" They're like, "No." I'm like, "Well, by the way, latching a baby on a flat nipple is really difficult." And then they start sobbing saying, "Why didn't anybody tell me? Why didn't anybody tell me?" And so I really want to start a campaign in medical schools where doctors and midwives and nurses are trained to look and assess and understand nipples. And that is not going on in this world.
Hmm. Yeah, that's a very fascinating, interesting point for sure, because there is anatomical, you know, variance, right, that you're mentioning. And the other thing that I see, which also can be make the breastfeeding relationship challenging, is if there's some birth strain or trauma, how that impacts the baby's alignment and the baby's physical anatomy and their ability to suck and latch properly and comfortably. And to your point, you know, tongue and lip tie, I feel like are becoming more and more prevalent as well, which impacts the breastfeeding relationship.
Well, two things I'm going to share with you is that number one, your birth 1 gazillion billion million, if that's even a number, affects the way the babies breastfeed. Epidural medicine, we know, enters the baby's body, can stay there for up to 2 weeks, creating an inability to coordinate, suck, swallow, breathe. And that impacts people. I tell my clients all the time, if you're having a dinner party and you give each person 3 shots of vodka, one's going to be drunk, one's barely going to be drunk. One cannot only not drive a car, Laura, they can't even walk down the street. And the other one's just a little tipsy. So when you give these numbing medicine to women, first of all, it affects them differently and it affects the babies differently. So you are 100% correct. Now, a lot of women need epidurals because they aren't taught the support they need during the birth. The nurses aren't supporting them. The doctors and even our modern day midwives are not supporting them. They don't hire doulas. So I tell
Well,
women,
thank God for doulas,
oh
definitely.
yeah, that's a discussion in of itself. But I tell my clients, even if you have a horrible birth, even if you have your big birth plan written out and it doesn't work, we can still fix the breastfeeding, Laura. You give me a woman with inverted nipples, a baby that's drugged up on an epidural, a woman that's crying and losing it, and I'm going to get that baby to breastfeed. And that's really the important message. Of course, we want women to have perfect births. It's not really happening that much in America. And thank God to doulas, I agree 100%. But even if women are falling apart and their babies are not cooperating on the breast, Laura, lactation consultants that know what they're doing can get even stubborn babies on the breast.
Yeah, so let's talk about those cases. I mean, you've seen obviously so many of these really challenging cases with the mother's nipples and the baby is like maybe their jaw is very tight and they have a tongue tie. Like how are you supporting that dyad and having a successful breastfeeding relationship?
So I learned from a woman named Shelley Marmette a technique called finger feeding. And it's not a great video that I have on YouTube. I need to redo it, but I do on YouTube have a video called Sara-Chana finger feeding. And finger feeding is a technique where you put a clean finger in the baby's mouth and you give the baby food with a dropper. You can't just use a dropper because you need that counter pressure on the baby's tongue. And whenever I have a situation that needs to be fixed, if I have a baby with some lockjaw and needs to be referred to a chiropractor, then we can finger feed that baby for 1 to 5 days while we get it together to release that jaw, and the baby will not have nipple confusion. If we have a woman that's got a flat or inverted nipple, we can use a nipple shield or not use a nipple shield. But if that baby has been getting bottles for 6 to 10 days, then that baby needs to finger feed. When babies finger feed, they will, within a couple days, go on the breast almost 100%, Laura. Because when you finger feed, they taste and smell skin, which is what they need to go on the breast. Also with finger feeding, they nurse with a flat tongue that does a peristaltic movement. And finger feeding, in my experience, is the most genius, brilliant invention to make breastfeeding work. So again, even if everything fell apart, if a woman comes into me and we finger feed from anywhere from 2 to 5 days, I'll be able to get that baby back on the breast, even with women that have horribly difficult nipples.
Interesting. So I'm just trying to understand. The mother has a clean finger. She's putting it in the baby's mouth. The baby's going to instinctively start sucking on it. And then the dropper with the express breast milk is next to the finger.
Yes. So it can be breast milk or formula, Laura, because depending on the woman's shaped breast, it depends on whether she pumps well or not. I always joke when I go into Zara to go shopping, which I love, they really don't have their model as a 5-foot tall woman that had 7 kids. That's me. So not everything in Zara fits me, right? So the same thing with a flange. They take 1 or 2 breast shapes and make the flanges around that, right? So you may just not be the breast model that they chose. So sometimes women don't pump well. But yes, we put the pointer finger in the baby's mouth with the fingernail towards the tongue. Shockingly, all babies will take you almost till the second bend in your finger, which is mind-blowing. And then you put the dropper next to the finger. We don't want the baby to feel the dropper, Laura. We want them to feel the pressure and weight and experience of the skin of the finger. And when a baby has nipple confusion, or we're waiting to get the tongue tie clipped, or we're waiting for them to go to a chiropractor like you to release the jaw, we can finger feed and then get that baby back on the breast because it takes care of and gets rid of nipple confusion. It's amazing.
Wow. Yeah, I've never even heard of that. So that's really a good share. I'm sure that's new for a lot of women. And I even worked with a couple lactation consultants myself after I gave birth, and I know the first one was advising using a dropper as I was those first few days as I was pumping milk, and instead of giving the newborn the bottle, but we didn't talk about the finger component.
Well, that's because that LC did not come to any of my clinics. And I do teach at medical schools, and I teach at breastfeeding conferences across the US, pushing this technique of finger feeding because it can fix 9.5 out of 10 problems. Now, it's not going to make that woman's nipple come out, but the baby will have such a passionate, wonderful feeling about the skin that the baby will work hard with us to learn how to nurse on the flat nipple. So a dropper is a good idea, but once you put the finger in the mouth, you're doing therapy. And excuse me, if we have a baby that's not coordinating suck, swallow, breathe, the pattern is suck, swallow, breathe, and suck, swallow, breathe. I tell women it's like a dance. They have to go suck, swallow, breathe, and suck, swallow, breathe. Boom, suck, swallow, breathe, and suck, swallow, breathe. It's really a dance, and not everybody's so coordinated. I mean, go to a nightclub, Laura. Some people are great dancers and some people are not. Same thing with breastfeeding. Some babies are great at coordinating and some are a little sloppy. So when you do finger feeding, it will also repair and help coordinate uncoordinated babies that can't do suck, swallow, breathe pattern in a beautiful fluid motion. How great is that?
Yeah, that's really amazing. So that's huge. I mean, I know a big part of your book too, you talk about the use of aromatherapy and herbs to help with emotional instability. And that's a big thing. And I'd like to have a conversation focused on women, specifically perinatal, that are going through a lot of hormonal changes in that period of their life. So how do you incorporate these types of things, homeopathy as well, to support women's mood during this period where not only are there hormonal changes, but there's also a lot of stress?
Absolutely. So I want to shoot out another statistic. And of course, we know these statistics can change all the time. So someone can Google it and say, oh, Sara-Chana, it's a different stat. Okay. Last time I looked at the statistics, 1 out of 5 Americans are on psychotropic drugs. These drugs are usually prescribed by their GP, their general practitioner, who spends about 6 to 7 minutes with per patient. Women will come in with normal complaints like, I'm feeling so moody, or I feel like I want to stab my husband, or I'm so angry all the time, right? Normal feelings. And they will instantly be prescribed psychotropic drugs. This is how I look at it. We've got a scale of women to the left that are really functioning well, but Laura, we have to worry about them, right? And then way to the right side of the spectrum here, we've got women that really need psychotropic drugs. They're born with an imbalance in their brains. They can have bipolar disorder or borderline disorder. And those psychotropic drugs can save their lives. So I want to preface this by saying I'm not against psychotropic drugs, but most people I meet are somewhere in the middle, Laura. They're sometimes together and sometimes falling apart, sometimes happy, sometimes depressed, right? So that's where herbs shine. For people that know themselves, they're self-actualized, but they just had a baby and they can't stop crying, or they're self-actualized and they're working on themselves, but every little thing is frustrating them. That's where herbs come in. So one of my favorite herbs for postpartum moms and beyond is an herb called motherwort. Motherwort is an herb. I like it best in tincture or liquid form as opposed to a tea. And it's for hormonal gloominess. Women can take it before their period, during their period, or after their period. They can take it postpartum. They can also take it perimenopause and menopause. Anytime you feel gloomy, you feel like that black cloud is descending, that's when motherwort comes into the picture, and it can really take away that stress and that gloomy feeling.
Hmm. I'm pretty sure I took that right after I gave birth. Um, and so that's good to know that this is also safe for breastfeeding moms.
Absolutely. You can take it. I like herbs best in tincture form. And what a tincture form is they take an herb, they put it in a glass container, they put grain alcohol or glyceride over it. It sits for 6 to 8 weeks. You strain it and you have your medicine. I like these herbs best in alcohol form unless I have a client that's going to AA and really struggles with alcohol. And the small amount of alcohol in the tincture is not going to negatively affect the baby, and it's going to positively affect the woman that's postpartum because the herbs break down in the grain alcohol, and the grain alcohol actually becomes medicine, Laura.
Right. And I think that I'm really glad you pointed that out because I use tinctures like that in my office with complex homeopathy as well as herbs. And it's a gluten-free grain alcohol. It's pure. Sometimes like a pregnant or new mom is like, oh, they see the ethyl alcohol as an ingredient and they get concerned, right? Because we're trained to avoid alcohol during pregnancy and breastfeeding. So it's a different version, so to speak. It's not like a glass of wine or something. Like it's really, and it's a very tiny amount, and it is medicine. It is a way to get the potent impact of the herbs and homeopathy into your system.
It's called botanical medicine, and it is a medicine. And so your question should be, why aren't there double blind clinical studies on all these herbs? And the answer is there's a lot more than people think because it takes 10 years from a clinical study to work its way down to the typical doctor's office. And the other problem is that so many of these herbs have a cultural and historical use that midwives have been using them for thousands of years without these studies. They know they work. They know they don't affect the baby. And so people aren't taking the money because it's millions of dollars to do a double blind study. Another herb I love is an herb called skullcap. Skullcap is for tension and nervousness and anxiety. And skullcap is in the mint family, safe while breastfeeding, and it takes the edge off of agitation. So, Laura, I have 7 kids. I have a girl, 5 boys, and then a girl. And when my 5 boys would come home from school, they were perfect angels in school, and they would come home and be terrors because that's a good sign. And I would take some skullcap right before they came home so that I would stay calm while they were acting like wild Indians. And it was great. Oh, I hate to say wild Indians, like wild children. And it was fine. I wanted them to get out their energy and I wanted to stay calm. If I travel, I do a lot of tours with my book and on breastfeeding, Laura. I travel the country. I do TV segments on all the networks across the country. And when I go to get on that plane or before security, I take a little skull cap, makes me calmer, and allows me, Laura, to smile at frustrating people rather than calling them out. And I think that's a good thing to have in your life.
Sometimes they need to be called out, but at the end of the day, I think to your point, we want to do that from an emotionally stable position, and we're really speaking our truth. And when we're moody, so to speak, that's the word that you're being using. It's hard to do that. So, I want you to share a little bit, like, why are women more moody or emotional than men in general? Like, what's the makeup there?
I love that question. So, according to Dr. Brazeltine, who's a pioneer on doing scans of the brain, she shares in her books that women use both sides of their brain at the same time, whereas men use one side of their brain when they're problem solving. So, that's why women can really love and hate a situation at the same time. They can love and hate their children at the same time. They can be frustrated and proud of their husbands and kids at the same time, because we really use both sides of our brain. So when we do that, it can look like we're a little crazy, because we can really kiss our child and yell at them and say, how can you do that? They're like, Ma, you just told me how great I was. Well, you are great, but you're also doing something wrong. What am I saying is that we always view things from two perspectives, and the two perspectives can be opposites. Also, women are very passionate. Oh, don't get me wrong. There are passionate men, and there are some women that are not passionate. But as a whole, women take things very seriously. We're the ones that know how to problem solve in a very different way than men. And women are a little bit more intuitive than men. Sorry if there's any men out there listening. And what Dr. Brazeltine has found is that when she does scans of women's brains, as they age, the part of their brain for intuitiveness grows bigger. So we used to have the concept of the wise older women. And Laura, we need to bring that concept back also. We're not, with social media and Instagram, being a little bit over 25 is not a good thing. But really, as women age, they get wiser, they get more intuitive. And that's an important thing. So back to our moodiness, because I did write my book, Moodtopia, and I wrote it because I want to say that moods can be negative, but moods can be positive. And I want to tell you a quick story. So I come from the Hollywood Hills in California. And by the way, Laura, I practice as a lactation consultant in California in the summers and in New York in the winters. So back to my LA story. So I live in the Hollywood Hills in the canyons, and there was one corner, all the roads are very twisty up there. There was one corner where my mother driving the carpool would say, oh my God, thank God we didn't get killed today. Because there was always a near accident on this corner, Laura, every morning with people speeding through the canyons. So my mother started getting angrier and angrier and angrier, and she called the city and said, we need a stop sign on that corner. And this was way before Facebook. And they told my mother, you need to go up and down the street and get 1,000 signatures. If you get 1,000 signatures, we will put a stop sign there. So my mother, with her anger, stomped up and down the streets, up and down the canyons, and she got 1,000 signatures. And to this day, Laura, there is a stop sign on that corner. So if my mother was passive, not passionate, and didn't get angry, the energy of anger, Laura, is powerful. We can either use that anger energy for destruction or to create and change the world. So if you're angry, you need to sit down and say, why am I angry? Is there any change I can make with this vibrant energy of anger? So being angry is not a bad thing if you use it in a positive way. What about being sad? Being sad and gloomy may feel very painful, but it gives you the ability to be compassionate for another person going through struggles. So if you never felt that sadness, how could you support a friend going through a trauma? So our emotions have negative and positive sides to it. And even if they feel negative, Laura, in the book Moodtopia, I encourage women to say, no. There's a lesson to be learned here. There's a reason for that moodiness. Get into it and use it to be powerful.
Yes, and that's a very valid point, that some of these emotions may feel negative, but there really, in my opinion, is no such thing as a negative emotion. They're all there to serve us. They're all part of the human experience. And it's, I think, about not getting stuck and that emotion that can be causing you to feel bad, but it is allowing yourself to process it because there's a reason it's there, right?
100%. So I love that you use the word stuck. So in Chinese medicine, if fluids get stuck, you're going to get an infection. Like if you get fluid stuck in your sinuses, you're going to get a sinus infection. If your kids get fluid stuck in the eustachian tubes, they're going to get an ear infection. So we want to make sure that fluids and energy don't get stuck. So anger is great unless a person gets stuck there and angry all the time. Sadness and depression is fine as long as you don't get stuck there. So I love that you brought up that word, and I do speak about that in my book, Moodtopia. I actually talk about the cycle of sanity, which is a little hard to do on the radio because I love to show it visually. But in the cycle of sanity, we talk about how your emotions cycle and change all the time. And it says that if you learn the lesson that you're supposed to with that emotion, then you don't have to experience that again. So rather than ignoring our emotions, ignoring our moods, if we stop and analyze them and learn a lesson, look, sometimes the lesson may be, Laura, that you can make no change. Sometimes you can be sad about someone's health condition, and the answer may be that you can't make any change and you just need to be there for the person. So I'm not saying when you analyze your mood, you're going to always have this epiphany like, oh, now I know what I can do to bring world peace. I don't know if that's going to happen, but certainly analyzing it and understanding that it's beneficial will give you the insight to take the path that you need to gain health and not create illness.
Yeah, one of the quotes in your book is gaining control by letting go, and I really resonated with that. You want to talk about that, like what that means?
I can't say I can't say that I do it so well. Go ask my
It's not easy.
kids. It's so hard, and it's so funny because I had a client in my office yesterday. She came in for a physical health challenge, and we ended up talking about a problem she was having with her daughter who was newly married. And she's telling me the story. And I, as a problem solver, that's what people come to me for, Laura. I'm thinking, I'm analyzing, and I finally looked at her and said, you need to just let go of this. And she was like, what? I can't let go of this. I was like, oh, by the way, I could never let go of this, but you know what? You need to. So it's something I work on all the time because I'm a problem solver and women tend to want to fix things. Sometimes you need to let go and just let it unravel without your influence. It's what wise women do, Laura, and you have to be really self-actualized to do it, and that should be every single one of our goals. So I'm still working on it, Laura. True confessions, I'm working on it. It's really hard.
It is hard. I'm working on it too, but it's something that I definitely see value in, and I think that as I have these similar conversations with my patients, and I think when you do with the healing arts, we become like therapists, right? And we're there to help because that's part of healing. When there's a physical symptom, there's almost always an underlying emotional symptom and, a block as well that needs support. And so it's helping people move through that. And, letting go. It's really about that surrender. And that's what birth is all about as well, right? It's just really letting go of wanting to control the situation and just surrendering.
Yeah, anybody that wants to. My sister's a songwriter, and she wrote a song. Her name is Shane Blue, and it's also on YouTube, and it's called Let It Go. And I'm not going to sing it for you, but it's let it go, just go with the flow, sit back and let it be. And when she wrote the song, I said, I hate you, that's terrible. So there's a very big difference between being passive and letting go. When you're passive and there's action that can be taken to change things, That's not what we're talking about. And I want to say that right now. It's letting go when you've tried all options and there's nothing more to be done. So I do want to encourage action. If people see injustice in the world, if they see injustice in their kids' schools, if they see injustice with the way they gave birth, you need to call it out. But then after the fact, you need to let it go. I think that's an important clarification.
Yes, it is. It is. It is definitely not about being passive or apathetic, but it's also, I think, getting comfortable with uncertainty, and that can be really scary for a lot of people, including myself.
Yeah. Yeah.
Yeah.
So can I
So
go ahead, Laura?
I was just going to say, there's, I wanted to just, number one, ask about your daughter that you talk about in your book. Is that your oldest or your youngest
It's
daughter?
my oldest daughter, yes.
Okay. So a lot of our listeners have not read your book yet, but can you please share that story? Because that obviously was a very pivotal, point in your life.
Right. So I had written my book proposal for Moodtopia. I had not sold my book yet. And my daughter got hit by a car and they assumed she was fine. We went to the ER. And a couple months later, my daughter became paralyzed from the shoulders down. And she was hospitalized for 7 months, Laura. They told me she had a condition called transverse myelitis. And they told me that not only would she never walk again, she would never get out of bed into a wheelchair. And after 3 weeks in the hospital, they gave up on her and wanted to put her in a geriatric old age home.
At the age of 20 something.
Yeah, she was 25. Beautiful, in shape, going to the gym. And what we realized later was that she had gotten a blood clot from the impact of the car. And no, we were not able to sue the driver, long story. And it worked its way up to her spine. Anyways, they had totally given up on her. And I want to tell you that I started using every single technique that I had written about in Moodtopia unconsciously. It's as if Moodtopia was my blueprint of how to get through a crisis. Now, nobody out there needs to go through this kind of a crisis to use Moodtopia, but slowly but surely, I started changing things. For instance, I put a big sign on the hospital door that said, if you're not happy and nice, do not enter this room. I did not want the doctors bringing in their mood or their frustration in my room. And the nurses and doctors told me that they literally had to stop, take a breath, and regroup before they came in our room, because literally, Laura, I kicked people out of my room if they were bringing in bad energy. The next thing I did was I brought beautiful plants and flowers and put them all over my daughter's room. I moved every piece of furniture, trying to get feng shui, trying to get that right energy in the room. And I started spraying essential oils. Now, I love using aromatherapy. I don't believe, like a lot of women on Instagram, that essential oils can really change very serious emotional challenges. I do believe herbs that you take internally can. I'm a fan of aromatherapy, but let me tell you how I used it. I started spraying lavender or grapefruit or lang lang, different smells in my rooms. And the nurses would come in and say, oh my gosh, this smells so gorgeous. What smell is this? Or they'd say, this is not my scent, but it's amazing, Sara-Chana. And what happened was the nurses and the doctors started coming to our room more often because beautiful plants, beautiful flowers. I put things up on the walls. I moved the furniture around. And I sprayed essential oils. And it became a gathering place, Laura. And in turn, my daughter got better care. So when you're in a hospital, it smells like death and dying, not on the delivery floor. And people are dying and people are chronically ill. And I couldn't stand that smell. So I saw that essential oils shifted the energy of our room, shifted the energy of a hospital into a place of healing. So I want everybody out there, and I do speak about this in the book Moodtopia, that although essential oils may not take away borderline personality, it will not. but it can shift the energy when you're in an emotional struggle to bring healing. And I want to say to this day that my daughter is out of bed. She's walking with a cane, soon to throw that cane away. I snuck in the hospital, Laura, acupuncturists, massage therapists, craniosacral. We did Pilates in the bed. I brought behind the scenes every alternative practitioner, and they, with my daughter's strength and her positive energy and her will to get better, she's better despite what everybody said. And that's
Yeah,
amazing. Yeah.
God bless. And that is amazing. It's a testament, number one, that the body is has an amazing ability to heal. And I think what I really appreciate about the story is for anyone listening with something that seems like, that it will never get better. You have to really ignore these experts that have this negative perspective because they don't know you, they don't know your body, they don't know your health or your child's, and anything is possible. Miracles are possible. And it's important to continue to believe that and to have hope.
Miracles with hard work. I do want to say that to get a baby that's not breastfeeding well takes hard work. To get through labor takes hard work. To heal from an injury takes hard work. But usually that hard work really pays off. I mean, it does. I
Yes.
see it
It
again
does
and
always
again
pay
and
off.
again and
Yes,
again.
it does pay off. And you're right, it's not easy, but it does pay off. In our office, we use aromatherapy every day. We spray it in our office, and we're in an office building, and literally it will waft into the hallway, and people are attracted. They're like they're just magnetically attracted to want to come into the space because it's relaxing, it calms their nervous system, and it feels healing. And that is the power of aromatherapy. I diffuse it in my home because it just helps us feel calmer. Who doesn't want to take the edge off without having to, use drugs?
Yeah. And again, I want to let you know that in Moodtopia, my book, and in my office, I'm not against Western medicine. I want to let you know that there are a lot of amazing pharmaceuticals out there. They might be being used in an incorrect way, in my opinion. But, we can use those medications. We can also use herbs and aromatherapy. It doesn't have to be one or the other. And when I do TV segments, which I do across the US, Laura, I teach people how to safely integrate alternative medicine with conventional medicine. And that's
Right.
a
It doesn't have
really
to be one or the
right.
other.
I mean, if a person's having an asthma attack, I mean, albuterol can save their lives. If someone's having an asthma attack, steroids can save their lives. But chronic use of that causes a lot of terrible side effects. So, in the acute state, those drugs are lifesavers. But in between, we need to figure out how to get that patient to not need their albuterol inhaler and not get to a crisis point where they need steroids.
Right, exactly. Get out of the fight or flight survival mode into really thriving. So that brings me to another couple questions towards the end of your book when we're talking about really at this point thriving as humans and women especially. You talk about the feng shui that you mentioned briefly with your story and how spaces impact our mood and color. Do you want to talk a little bit more about that?
Yes. So I want to tell you that I was a doula at a woman's birth. I helped deliver over 469 babies. And after I helped this woman deliver her baby, her husband went over to her and said, "We are not giving Sara-Chana money because she's only going to spend it on her children. And we need to give her something that's for her." So she said to me, "I'm not paying you yet. Give me a little time to figure out." And I was like, "No, I'll take the cash." She said, "No, we're not giving you cash." Okay. So all of a sudden, I get in the mail a certificate to get my color palette done. And I was like, "Really? Are you kidding me?" So I'm adventurous and I made an appointment. And I sat in a chair, Laura, without makeup, with my hair, in a pony. And she started throwing color cloths on me for a couple hours. And she analyzed the color of my eyes, the color of my skin, and she gave me a palette of colors that bring out the best in my features, not changing my features, but bringing out the best in me. And I have to tell you that it was a life changer, because when I put on a coral, which I would have never worn before my color palette being done, I look better in the mirror. And even if I'm having a horrible day, Laura, I get a little twinkle in my eye. And when
I love coral too, by the way.
Right. And then when I wear an obnoxious yellow that most women can't wear, I look sunshiny and it gives good energy. So what I learned from this was, if you're having a horrible, bad things happen to good people, Laura. You can have a bad day, a bad week, a bad month, a bad year. Of course you can. But if you're having a bad day and you put a turquoise blue scarf around you, you're going to feel better, because color emits energy. The way we see energy is by the vibrational movement that energy sees and feels from our eye. And so energy has color. So if you're sitting in a drab job and you hate where you are, but you need it because you're a single mom and you've got to pay bills, bring color into your office. Bring color into your car. Bring color into your bathroom. And it will not change the difficult thing you're going through, but it'll give you a little better perspective and bring that good energy. Because, Laura, we are energetic beings. My son is in a PhD program. He's a physicist. He said, Ma, you can never talk about energy because you don't understand it. So I'm going to break his rule, Laura, and say, I talk about Moodtopia, about energy, because when someone walks in the room, you know right away whether you like them or not. It doesn't mean, Laura, as a practitioner, we can't get past that. But someone will walk in the room, you're like, oh my God, I just vibrate with this person. You walk into a restaurant, even before you eat the food, you're like, oh, I love the energy of this place. So when we live as energetic beings, we need to bring energy around us that makes us feel good, because this is a really difficult life to live in, Laura. It is. It's difficult.
Yeah. It is difficult, and there's good days and bad days, or months, years, even like you mentioned. And despite what's going on in our external environment, there's so much we can do to support the way we feel. And am a strong believer that the more we do to support feeling good with our body and our emotions, the more we're going to attract more of that positivity towards us.
Right, right. And I think, I tell my clients all the time, you have to work at being positive. You have to work at feeling good. Yes, it's true that some people are naturally happy, but if you're not that person, you can get better at working at it. Like, you may not be good in Pilates, but the more you do it, the better you get. You may not be good at jogging. The more you do it, the better you get. The same thing with being nice to people, Laura. There's something called random acts of kindness, RAC. And I speak about it in my book, Moodtopia. And it goes like this. If you hold the door open for someone, besides helping that person, doing a random act of kindness lowers your blood pressure and lowers your cortisol stress levels. So in order to create a better energy around you, doing random acts of kindness is inexpensive. It costs no money. You don't have to be in a good mood to do it. And when you take on doing random acts of kindness, you bring kindness into the world. You help people that you don't even know, and you get the benefit of feeling better. So that's an easy thing to take on every day.
Mm-hmm. You feel better, and then the person that you just helped feels better, and it's a trickle effect. Then they're going to be more likely to do a random act of kindness, and it pay it forward, right? It's powerful. I mean, I find just smiling and saying hi to a stranger on the street can be big. And, being in the New York area, that's not really common, but I grew up in North Carolina where everybody says hi and smiles at everybody else. And so I think that I'm lucky that I had that in, upbringing so that I can bring it up to New York and share it.
You're going to laugh. So I'm originally from LA and now I live in New York and LA. So here's the thing. I do talk about the importance of smiling in my book, Moodtopia. So when you're in LA and you smile at someone else, they say, oh, look, Sara-Chana had a facelift just like me. And so when you're in New York, you smile at someone, they're like, oh my God, watch out. She could be robbing me.
Right. She just took my wallet. Very funny.
So we have to do it anyway. So it's very specific to the area that you live in. But yes, Laura, no matter what people are thinking, we need to start smiling at people. I agree 100%.
And the more we smile, it really does make you feel better inside yourself. And yeah, it is interesting. Some people will be like, what's going on there? But that's their stuff, right? I mean, it's like, regardless, you've done something good for yourself by smiling at someone. It's like sharing love, right? You're sharing a small, short heart connection with a stranger.
Well, that's really, if we think about my book, Moodtopia, people were like at first, like, moods? No one wants to talk about moods, Sara-Chana. No one wants to say they're moody. Like, really? The book Moodtopia? But if you think about emojis, everybody adds emojis. That's like the big
and
thing.
Those are moods.
Like I was like, yeah, the world needs my book Moodtopia because the world is using emojis. You're like, thumbs up, that's a mood. Thumbs down, that's a mood. Smile with hearts, that's a mood. So we really need to connect to our moods. And that's why my book is very appropriate for the times we're living in.
Yeah, it really is. And I would say in the past few years, it's been a little bit more intense, right? With the energy. So I think it's like that impacts us, right? We are energetic beings.
We are. And I have my Instagram page and I'd love for everybody to follow me. And I have my Facebook page and I'd love everybody to join me in the conversation. And that's Sara-Chana's, Sara-Chanas. But we aren't interacting with people like we used to, Laura. And social media is really not so social. And the more isolated we become and the less interaction we have with people, the more moody we're going to be. And it's really important to join a book club or join a Mommy and Me or join a once a week lecture. It's really important in this time of social media to make sure that you actually do something social because that will help with your moodiness also.
Yeah, we as humans, we are, one of our primary needs is love and connection, right? And I think sometimes people think that they're connecting through social media with others, but it's a very superficial connection. And, face to face, coffee with a friend or whatever will certainly fill you up a lot more than a Facebook post.
Yeah, coffee with a friend, turning off your phone. It's quite scary. Everyone will have withdrawal symptoms. And the question is it harder to withdraw from heroin or opiates or your phone? And I'm going to vote that it's pretty darn equal. So it is a challenge. We need to start the challenge out there, Laura. The challenge is have coffee with a friend, shut off your phone, talk. And people really feel better when they do that. And that's part of finding your Moodtopia. And my book, Moodtopia, the line is be in control of your moods so your moods don't control you. So like you said at the very beginning of the conversation, if you're going to yell at someone, do it out of a place of strength, not when you're losing it. And it's the same thing here. You can have all these moods, Laura. You just want to have a handle on them and use them when they're going to benefit you and the world around you. And they will when you focus in and tune into it.
Yes, well said. Well, Sara-Chana, I'm so grateful for your time to come on to the show today and share your wisdom. Do you have any last thoughts?
Laura, I want to thank you for your amazing work and your amazing podcast and your wonderful work with your patients. Keep up your great work. And I just want to share with people that I'm reiterating that it's hard to be in control of your moods. It's hard to find the positive when there's so much negative. And just like you had to practice your handwriting as a little person, you need to practice this. And the more you practice being in better moods, understanding your moods, the better you're going to get at it. It doesn't come naturally for most people, Laura. And that's what I think the important message is.
Right. So even if it's not natural, it doesn't mean it's not something we can improve on, just like any other skill set.
Yep, absolutely.
Wonderful.
Absolutely.
Well, thanks again for coming on.
Thank you, Laura. Pleasure working with you. Not working with you, pleasure being with you.
Thank you.